Benign prostatic hyperplasia affects approximately 50% of men between 51 and 60 years of age, and up to 90% of men over the age of 80. As the U.S. population ages, the prevalence of BPH is increasing. As a result, more in-office procedures are being offered to men who have elected to discontinue BPH medications, have chosen not to take BPH medications, or are not receptive to surgical procedures. For BPH patients who choose to have an in-office procedure, managing patient comfort is an important part of the procedural experience. There are several options used to manage patient comfort during procedures. Common protocols include oral anxiolytics with narcotic or non-narcotic pain medications, IV sedation, or a prostate block. In this video, Dr. Randy Beahrs from Metro Urology in St. Paul, Minnesota, will share his experience in managing patient comfort for in-office procedures.
Hello, I'm Dr. Randy Beahrs. I'm a practicing urologist in the Twin Cities with Metro Urology. Over the last 10 to 15 years, I've been involved in office procedures, minimally invasive procedures for BPH. And in an effort to make these procedures comfortable for my patients, I have been working on different protocols for pain control and pain relief during the procedure. I currently have a procedure that is a modification of the 1996 technique described by Nash. Those of you who use this technique are familiar with the White Mountain or Mount Blanc or Mount Everest hyperechoic area that's below the seminal vesicle, and we inject into this site and get a good response, good pain control. I've modified that technique a bit and now put an additional amount of xylocaine above the mountain in the clouds above the mountain, and actually that's where most of the nerves are. So this technique has been very successful. Patients notice a big difference. I've had the opportunity to use both techniques on same patients, and they usually will say that it's a far better technique. So in an effort to make patients comfortable, this is something that you might want to consider if you do use local anesthesia for minimally invasive procedures. We've pretty much stopped using all oral medications, which is a big advantage. These patients can come have the procedure done and drive home and not have any long-term side effects from oral pain medication. As with any block that you do, always watch for bleeding and infection. So these patients are given Cipro 48 hours ahead of time, taken off all anticoagulation and aspirin. We're looking at a diagram of the male reproductive system, and I will point out the obvious: the prostate gland, the bladder, and the seminal vesicle. In order to perform this modified block, we would first use a 22 gauge needle. I put 10 cc's on the right and 10 cc's of lidocaine on the left, but the first 3 or 4 cc's go into the traditional Mont Blanc site, and then a little bit under the prostate here, and you'll see that in the video. And then I slide the probe laterally a bit and put the 3 or 4 cc's into the clouds above Mont Blanc. And these are the inferior hypogastric nerves. You can often get a response. The patient will notice some mild discomfort as the injection occurs, and you'll feel a gritty area in that tissue. Remember that there is a small artery that runs right along the seminal vesicle. We'll want to avoid that with our needle as we do our block. And so these are the landmarks that I use when I do my block, and now we'll see a video that shows it even more dramatically. So we are currently looking at a video of a patient that's about to have a minimally invasive procedure. This is the transverse view of about a 30-gram prostate. The patient has quite a large median lobe. This is the sagittal view, and you can easily see the seminal vesicle, and the traditional site of Mont Blanc is a little bit underdeveloped, but the most important part that we're seeing are the white clouds above Mont Blanc, which is where we really want to put at least 4 to 5 cc's of our xylocaine. So on the picture you see the bladder, and you see the prostate, seminal vesicle, a poorly developed White Mountain, but a very nicely developed clouds above White Mountain. So we'll move ahead now. I've showed you both sides of the prostate. And in just a moment, I will use a 22 gauge needle and inject about 3 or 4 cc's into the White Mountain site. You can see my needle advancing here now. There it comes, 3 or 4 cc's of xylocaine. and then I pull back a little bit, put a little bit under the prostate, and then go lateral and go above White Mountain into the clouds and put another 4 or 5 cc's. You can see it going in there now. And that only added about 5 seconds to the procedure. We go to the other side now and do the same thing. You can see my needle coming into the hyperechoic area that we affectionately call White Mountain. Put about 3 or 4 cc's there. Here comes the needle. And then I pull back a little bit, get some under the prostate. And then you'll see the seminal vesicle disappear as I go lateral and go right above Mount Blanc into the clouds, another 5 cc's of xylocaine. And that's the block. So these patients are given Cipro 48 hours ahead of time, taken off all anticoagulation and aspirin. The first 3 or 4 cc's go into the traditional White Mountain site, and then I pull back a little bit, put a little bit under the prostate, and then go lateral and go above White Mountain into the clouds and put another 4 or 5 cc's. There are some blood vessels in the area running near the seminal vesicle that you have to be careful about. Well, I hope this video has been helpful in understanding the modification that I use for the periprostatic block. Please give it a try. I think as urologists are doing more and more in-office procedures, it's going to be important for us to have good pain control for our patients. They'll appreciate it. You'll appreciate the ability to do things without patients moving or flinching during the procedure. And as we do more in-office therapies such as Resume and some of the blocks that we're using for UroNav and some of the biopsies we do, all of these things will be made more comfortable for the patient by using this periprostatic block. Thank you.